My presentation is healthcare delivery system in Nigeria and its major challenges. Introduction. The work is about healthcare delivery system in Nigeria and its numerous challenges. As we all know, Nigeria is a developing country and is located in Africa in the tropical region. Here we have a lot of problems that is challenging our healthcare delivery system, such as ignorance, mass poverty, illiteracy, women and disempowerment. We also have harmful traditional practices that hamper on our health system. We also have lack of infrastructure, very high population and poor social schemes. All these factors are leading to the backwardness of our health care system. Going by our literature review, it is already known that there are several problems facing the health system and services in Nigeria. This is particularly the reproductive and community health care in Nigeria is very, very necessary and very, very vital, and they have been mostly affected by these challenges. Like I said, one of the biggest challenges we'll be having is the poverty level in the country. A lot of people, in fact, more than 80% of our population live below $1, and you can see that people do not really have money to access our healthcare facilities. So poor health practices also affect our healthcare delivery system, and these poor health practices includes people not really knowing they are not really knowing what to do when they are sick. You find out that there are a lot of misinformation in the system. A lot of people still depend on religious belief in treating themselves. Some also go to quacks because quack health personnel, they also collect little money which people can afford, and all these things are challenges to our health system. um, Nigeria, as we can see, Nigerian average life expectancy is also very low. Right now, it is at, we say it's 44 years. That's our average life expectancy because of these challenges, especially the issue of poverty. The issue of poverty. Then, from what has been done before, you find out that it's also known that apart from poverty, the impact of education is also affecting us. We have a lot of problems here where we say illiteracy is a very big problem. People do not even know how to deliver first aid when someone is sick. Things like oral rehydration, abuse, oral rehydration, people lack that knowledge en masse. People also abuse medications, especially antibiotics. Also, we find out that a lot of people go to the pharmacy or the chemist and pick up drugs without prescriptions. Also, the use of contraceptives, people do not have the basic knowledge on how to use them, and this is also affecting our population. People have a lot of unwanted pregnancy and lack of family planning. Another major factor that is affecting our health is the environmental factor. Here, I mean that when we talk about environmental factor, we focus on the situation on ground and things surrounding us, such as the pollutants and the climate. We also know that there are a lot of gas emissions and a lot of industries operating in Nigeria without meeting up with the air standard, the quality air standard. So we see that the environment is also contributing to our people being sick. We also have socio-cultural factors. Um, Here we are talking about women not really having the right to go to hospital, especially in the northern part of Nigeria. Women must seek permission from their husbands and their family before they go to hospital. At times, before they are given that permission to go to hospital, the woman in question is already very critical and might not even live to get to the hospital. So the cultural practice is also a problem. We also have bad cultural practice such as female genital mutilations and all that. Our research actually was done in Ebonyi State, that's in the southern east part of Nigeria, and the research data was collected. We did a quantitative data. Questionnaires were administered. So we gave out 25 copies of questionnaires to patients in 5 different hospitals. We didn't do this considering age. We gave it to people that we saw, and we did not mandate them. It was actually voluntary, irrespective of their literacy level, their sex and age. We didn't mandate any person to fill the questionnaire. They opted to do that, and we asked 10 knowledge questions, which we were actually looking for negative and positive responses to determine the opinion of these patients towards our healthcare delivery system. Well, we found out that in the answering of questionnaires, we found out that 70% of the population of the people, the research participants, agreed that they had healthcare facilities around them or in their location, while 30% disagreed that their healthcare facilities were very far away from where they stayed. Then 60% of the research participants also agreed that the healthcare facility was accessible. Here we were looking at means of transportation and good roads to get to the hospitals. 60% agreed, while 40% said that the hospitals were not really accessible to them because of long distance and bad roads. Then 55% of our participants agreed that the hospitals around their location were functional, while 45% disagreed that most of their facilities were not functional. They had facilities, but they were not working. Then 55% of our participants also agreed that the health workers in the facilities where they attended to were friendly, while 45% of the participants disagreed and said that their health workers in those facilities were not friendly and did not give them the required attention. We also found out that 75% of our participants agreed that the healthcare facilities were equitably distributed amongst these urban and rural areas, while 25% disagreed. Then we found out that 90% of our research participants, as the patients, disagreed that the referral system in Nigeria was poor and it wasn't working, while only 10% agreed that there was a good referral system in our healthcare. Then 80% of our participants disagreed and said that the government is not giving the healthcare system in the country enough support, especially in our communities. Then 95% of our participants also made us to know that they had no healthcare insurance or any other social scheme that could cover their hospital bills. 70% of our participants also agreed that they were allowed to spend much time. So time was not a problem in the hospital. When they come to the hospital, they were given time to explain their problems. While 80% of our health participants said that the healthcare services in their location was not affordable. So From our little research, you could find out that there are basic problems. One, most of the health care facilities are not functional. They are there, but they are not functional. Then there is poor health insurance scheme. In fact, apart from the government workers and people that work in big establishments, the masses do not have any health insurance scheme covering them. Therefore, they are expected to pay for their health services, ranging from the childbirth, delivery, to maternal care, to handling of critical illnesses. People pay from their pockets. And remember, we have poverty in this country. Then we also find out that the government is not really putting enough, there is no political will. They are actually not putting enough effort to beef up our healthcare system, to make our healthcare systems functional. While there are so many hospitals around, most of them have no doctors, no qualified nurses. They are not functional. So the essence is people go to hospital around them and they are not functional. One of the biggest challenges we also have is the referral system. When people go to hospitals and they cannot be managed in those hospitals, you find out that they are not properly referred to a tertiary healthcare institution where they will be handled. In fact, most of our patients, when they are referred, they either go to the hospital and receive little attention, or when they go, they start afresh to undergo the process of seeing a doctor and all that. And before they are being given that full attention, you find out that the hospital case is already, the patient's case is already critical and is in a bad state. In fact, most of our patients in this country die because of lack of good referral system. So it's a major challenge. Now, recommendation. I'm saying, out of this research, I am saying that we need both human and material resources to make our health system workable and functional. Health services should be made accessible, available, acceptable, and affordable to our citizens. In fact, there should be a good health insurance system in place in the country, covering both government workers and people that are not working with the government. There should also be provision for ambulances, communication gadgets in the rural areas, where there is inaccessible roads and bad communication. So there should be ambulances put in place and communication gadgets to help the health workers in the urban areas to work in good synergy with those ones in the rural areas. Then the government should see a way of subsidizing the health costs, probably by helping in payment of drugs, making some services free of charge, such as the treatment of malaria, typhoid, which is very endemic in this part of the world. We should also see if family planning and child delivery, safe child delivery, should be made free of charge or subsidized by the government, so that people could always access health easily, instead of allowing them to look for money and cater for themselves 100%. And that has been the challenge. So we are pleading on the government.